Hello everyone, I am Dr. Monica. Today I am going to discuss about what is an inverted nipple and how it can affect breastfeeding. I will also give you a few tips to overcome the breastfeeding challenges with inverted nipple. So what is an inverted nipple? Inverted nipple are those which are retracted inward instead of protruding outward. This can be temporary or permanent. It may vary in severity. There are many reasons for the inverted nipple, including some tissues that connects the nipple to the underlying breast tissue, which makes the nipple to be flat and inverted. And because of the previous breast surgeries and nipple piercing, the nipples can be inverted. So how does an inverted nipple can affect breastfeeding? In many cases of flat nipple, babies will not have any breastfeeding issue, as the baby need to latch to the areola, not to the nipple. So while the baby is breastfeeding, the baby need to latch to the areola, not to the nipple. So babies will not have any feeding issue. However, babies will have difficulty in latching onto a truly inverted nipple, which can lead to frustration to the both mother and babies. So improper latching of the baby to the nipple can lead to inadequate feeding. This also leads the mother to experience discomfort and pain during breastfeeding. So let me give you a few tips to overcome the breastfeeding challenges. So tip number 1, gently pull the nipple and roll in between your fingers. So this will lead the nipple to protrude outward. Tip number 2, briefly touching the nipple with cold water for few seconds will help the nipple to protrude outward and reduce the swelling. Tip number 3, so this is called syringing technique. So using the syringe, we can protrude the nipple like this. So this leads the nipple to protrude outward. Tip number 4, if the areola is swollen, gently massaging the areola and expressing the milk. So by this technique, we can loosen the areola swelling. This leads to the nipple to protrude outward. And we also have a reverse pressure technique. By using the 2 fingers, we can use this massage technique, and gently massaging the areola for few seconds can relieve the areola swelling. And tip number 5, you can compress the breast and areola between the thumb and index finger like this. So this is called C technique or sandwich technique. So if all of this technique fails, nipple shield is the only technique which can be used temporarily, that is also under the supervision of healthcare professionals. So if you are unable to help your baby latch, you can express the breast milk and feed your baby using a palade or a cup while attempting to improve your nipple protrusion. So if only one nipple is affected, breastfeed on the other side of the nipple while expressing on the other side. And the final precious advice to all my mothers, patience and practice is the only best advice I can give. It may take time for both mother and baby to adjust. So be patient and try to remain calm during the breastfeeding sections.